Most of our patients, when they arrive in our office, they're very nervous. They don't know what to expect. This is the first time that most people have ever had a cancer diagnosis, and it's scary. It's really important that their first experience in our department be one where they can feel that they can trust what is about to happen.
What I like to do when we see our patients in the office is prepare them that they have a team, that we're there every day to discuss with them, to help care for them, and recognize that we're treating them at a critical time in their life.
Patients are overwhelmed with the breadth of information that doctors give them, and they only retain so much of it. So it's important to me when I meet a patient to make sure that they understand every aspect of their care.
We sit down, review the patient's entire medical history, their medications, review their pathology and their x-rays, discuss treatment recommendations with the patient, answering all the questions that they may have. We talk about side effects and toxicities of treatment, expected outcomes of treatment.
I really encourage patients to bring their family members, neighbors, friends, and lots of questions, so that we spend a good deal. That first visit will typically take at least an hour.
We start the patient out with what we call a simulation, where we actually place them on a design table that is similar to the treatment table in what we call the treatment planning position.
There'll be some small tattoo marks placed on your skin, which are permanent marks. You can shower and bathe. They won't come off. They're very small. They're about the size of a freckle.
Once we map out the tumor, the dosimetrists and physicists do all the calculations necessary to provide the treatment. We set up the treatments on the machine, make sure the setup is accurate, and then deliver the first treatment.
Not all radiation therapy is delivered for the same amount of time. It usually just takes a few minutes that day, but some patients are treated in a few days, some are treated for several weeks. So it really does vary depending on the patient and the tumor and the plan that is designed.
Each treatment, you have a set appointment time, so you don't have to wait around and wait for the doctor every day.
There is no preparation. They can eat or drink anything they want before or after their treatments.
They lie down on the treatment table. We take x-ray pictures, and the treatment machines even have CAT scans on them, and we take CAT scans while they're lying, waiting to be treated, to make sure they're in exactly the right position.
There's nothing radioactive in the room. Patients aren't radioactive when they go home. It's a high-energy x-ray beam. I describe it to patients, it's like turning a light on. You don't feel anything, it doesn't hurt.
They're usually on the machine for a few minutes. The radiation is delivered, and then they can get up and leave.
And then each week during that, the physician, or sometimes the physician's assistant, will see you and make sure that things are going smoothly and that any other questions you develop or side effects are addressed.
An advantage we have in this organization is 30 years of experience with top-flight, cutting-edge technology, with a tremendous behind-the-scenes crew of experienced, nice, quality people.
We have a dietitian, and a lot of our patients need nutritional counseling to try to help keep their nutritional status up while they're going through radiation or radiation and chemotherapy.
We have office financial managers to help people through all the financial issues. We have counselors to help people with some of the emotional issues.
You really need a very good team for radiation because, first of all, patients are often coming in for several weeks, and they become very close with you're the nurse, the technicians who work the machines, and it's very important to have people who are caring in those positions.
There's a solution to every problem, so once they're here, we're here to help and be here for the patient throughout the whole treatment.
We were glad that they're done with their treatment so they can move on with the next part of their life, but at the same time, we're like, hey, it's kind of, we kind of lose a friend.
We take care of people from the start to the finish in a way that is not just about the technology, but it's about caring for the whole person.
The office is warm and inviting, and we try to be as supportive as possible. We take all the time that anybody needs, and I think that our reputation is based on that.